right. This patient is, what is the most likely cause of her diplopia? So let's see here. Okay, seems like could be a few different areas. 35-year-old woman presents with 1 week history of double vision. She complains of horizontal diplopia, which is worse when she looks to the left. On examination, her eyes fail to fully abduct when she gazes to the left, while her right eye exhibits nystagmus during abduction. The rest of her neurological examination is unremarkable. The patient has a history of fatigue and muscle weakness. Okay. Um, so let's see. Only when she looks to the left. The horizontal diplopia, which is worse when she looks to the left. She's 35. Hmm. I
So
don't like, I mean, I was thinking off the bat, I was thinking like the something with the abducens because it's about abducting.
okay,
But I'm not super confident about it. So let's see. I don't think it's myasthenia gravis here,
okay,
even though she has the fatigue and muscle weakness. I don't know if there's enough evidence to support that. Optic neuritis, I'm not exactly sure what that is, but I'm just guessing it's an inflammation of the optic nerve,
okay.
which I don't think this is either. Trochlear nerve palsy, I'm trying to remember what that even is. Trochlea. Um, and then the INO, it could be this because it could be MS symptoms because she has the fatigue, she has muscle weakness, but she doesn't have any of the other neurological symptoms. No, nothing else in the neurological exam is remarkable. Um, if it's an abducens nerve palsy, I'm wondering if it would just be one side while her right eye. Oh, wait a minute. It might be INO here. I mean, she fits the demographics. I
You're
let something is some. I'm remembering some picture with MS where like one eye goes one way and one eye either stays the same or something. So just based on that image that came into my head when we were talking, I would go with that, but I'm not super confident.
okay. Good. Yeah. So
Okay.
so I think you worked through this question really, really good. Okay. Couple things I want to mention on test taking strategy, right? You had a gut answer choice, right?
Mm-hmm.
Kind of point to this, you kind of stuck with it, you're unsure, right? But you stuck with this. So, a lot of this test is, being comfortable with being uncomfortable is kind of what I
Mm-hmm.
always say, right? You're not completely sure. But yeah, so internuclear ophthalmoplegia, right? Horizontal diplopia, left eye abducens deficiency, right eye nystagmus and abduction are consistent, right? Lesion of the MLF, which connects
Mm-hmm.
abducens nucleus to the contralateral oculomotor nucleus. So, it's that
Okay.
reflex, right? Where your eyes are paired, right? If we didn't have this, our eyes would be like chameleons, right? Obviously, our eyes
Oh,
can't
okay.
move by itself, right? So when you
Oh, that's
move left,
cool.
the right eye will move adjacent, right? Accordingly, right? So that's why you always
Okay.
move your eyes in coordination, right? Abducens nerve palsy is an isolated one side
That's what I
lateral
was
rectus
thinking. Okay, it
muscle.
wouldn't affect the other eye, right? It would just be
Exactly. Mm-hmm.
one like palsy. Okay.
Yep. Myasthenia gravis, right? Muscle fatigue, weakness, right? Usually
Mm-hmm.
later, right? And then
Yeah,
optic
like later in the day they get weaker.
Mm-hmm. Mm-hmm. And then optic neuritis is going to be with MS. Okay, that's usually with MS, and you get
Oh, okay.
pain with eye movement, and it's a lot of pain. The key thing is pain and visual disturbances. And then trochlea, right, is the super oblique muscle, right, causing vertical diplopia, right. And so remember, your superior oblique muscle kind of works by moving your eye in two dimensions, right, in a oblique fashion, right.
Is that
So
the down and out or up and in?
I think it pulls it up and out, I think, if I'm not mistaken. Let me see. Hold on. Let's see.
Trochlear nerve, because like I was thinking it's a
Superior
little
oblique function. Let me remember here. It is intorsion and depression, actually. Abduction of the eye. So it does, like, it's like a cross of it. So intorsion and then
okay.
depression. So in and down.
Okay.
Yeah, So,
Okay.
all right.
And then INO is not MS. I thought it was related to MS.
INO, is it related to MS? I didn't, let me see. How do you spell this?
I might have been thinking something.
Intranuclear off factor. Let's see. Oh, it is also good.
Okay.
Yeah, I forgot that. So definitely something new I learned. So it can be also with MS.
Okay.
Good.